The bill in question, sponsored by Senators Bill Cassidy, RLA, and Lindsey Graham, RSC, would get rid of the Affordable Care Act, putting in its place a state-run system that would provide substantially less financial help and offer far fewer protections for people with pre-existing conditions. The number of people without insurance would be 21 million higher by 2026, according to the most recent and reliable estimate, while federal spending on healthcare would decline. Republican leaders are desperate to fulfill their oft-repeated campaign promise to repeal Obamacare, in part to satisfy their donors. But even before Cruz signaled his possible opposition, and Lee's a handful of other GOP senators either had come out against the repeal bill or were on the verge of doing so. Senator John McCain of Arizona on Friday said he could not vote for the proposal, partly because his party's leaders were rushing it to the floor without lengthy committee hearings or even a full Congressional Budget Office analysis. Senator Susan Collins of Maine indicated on Sunday that she too was likely to vote no, pending a preliminary and incomplete assessment that the CBO has said it would provide Monday. Senator Lisa Murkowski of Alaska, who like Collins and McCain voted against a different repeal bill in July, has expressed strong skepticism about the latest effort. Her state's governor has also spoken out against the bill. Opposition from those three senators alone would sink the Graham-Cassidy bill. But if Cruz is right, the bill has just as many dissenters among the most conservative members of the GOP caucus. Senator Rand Paul of Kentucky has said repeatedly that he opposes the bill because it leaves too much of Obamacare in place. On Sunday, he reiterated that position on NBC's Meet the Press, saying he could only support the bill if its sponsors dropped the new spending that is supposed to replace, albeit incompletely, the Affordable Care Act's coverage expansion. Statements of position are not the same as actual votes, obviously. Cruz didn't slam the door on eventually voting yes, saying that he had ideas on how to improve the bill. Cassidy and Graham, for their part, have said they are revising their measure, in a bid to win over some of the skeptics. But the path to putting together a simple majority for the bill is awfully hard to discern at this point. Even if Collins, McCain, and Murkowski were willing to put aside their concerns about the process that produced the bill, it would likely take significant concessions on substance like giving more money to Medicaid, or strengthening protections for coverage of people with pre-existing medical conditions to win them over. But such changes would further anger conservatives like Cruz and Paul, who say even the current bill leaves too much federal spending and too many insurance regulations in place. Meanwhile, the bill is getting little support in public opinion polls and continues to generate vocal, widespread opposition from the world of healthcare. That includes groups representing doctors, hospitals, and insurers who issued a rare joint letter on Saturday, as well as panoply of patient advocacy organizations.